Hello everyone. Our today lecture is going to be about a very important medicinal subterranean organ named as licorice. This is for PharmD third semester students, presented by me, Dr. Shema Abdelgawad, lecturer of Pharmacognosy, Faculty of Pharmacy, Fayoum University. Redix glycyrrhiza in Latin, or known in English as licorice root or sweet wood, or known in Arabic as جزر السوس أو العرق سوس, is a very popular drink in Middle East, especially here in Egypt. And on our today lecture, I'm going to discuss the following topics in this presentation: botanical and geographical origin, morphology and microscopy, active constituents, chemical tests for identification of those constituents, uses, dosage, side or adverse effects, contraindications, drug interactions, as well as examples of licorice products in Egyptian pharmaceutical market or herbal supplement market. Botanical origin. Licorice consists of the dried, peeled or unpeeled roots of and stolons of Glycyrrhiza glabra family Leguminosae. There are two varieties very common, known as variety typica, which commercially known as Spanish licorice, and variety glandulifera, commercially known as Russian licorice, and this correlates to the geographical origin that will be discussed in the next slides. Geographical origin. Actually, the licorice is native to Spain and Russia, so we have the variety Spanish and Russian licorice, and also it's native in England, France, Germany, USA, and also in Egypt. Now I will discuss with you the basic morphological characteristic features of licorice root and stolons. As we discussed in the origin of this plant, we said that it constitutes of peeled or unpeeled rhizome and stolon and roots of Glycyrrhiza glabra. So we can here will discuss the morphology of both root and underground stem known as stolon. Externally, the root is characterized by the following: it's long, straight, nearly cylindrical, and it shows longitudinal wrinkles on its external surface and grayish brown to dark brown in color. Internally, it's yellow and fibrous. What about the stolon? It's similar to the subterranean root, but is characterized by the presence of nodes and nodes externally and both internally in its structure. These are the photos of peeled and unpeeled licorice. We can see here, if we can peel the licorice, mean that we remove its cork, the dark brown cover, and this is peeled. This is unpeeled root. Both peeled and unpeeled are characterized by a sweet taste, but the unpeeled root is also have additional slightly acrid taste. So when we are going to use a good taste licorice, it's preferred to use the peeled licorice. When peeled also, the outer or external feature is different from the unpeeled root. Its color is yellow, not brown, and also it shows longitudinal striation or the shape of fibers, and no dark buds appear on its external surface. Microscopy. This is a T-transverse section in the stolon of root, a stolon of licorice, showing the following tissues, as we can see here in this TS diagram: the cork, And then the cortex layer, we can see here, we will discuss each one separately now, but here a brief hand. Then the cortex layer showing calcium oxalate prisms and starch. Then the vascular bundle layer characterized by phloem region characterized by phloem fiber and the xylem vessels after it. And finally in the center the base, because it's a subterranean stem. The first layer is the cork. It's radially arranged rows of thin-walled polygonal tabular narrow cork cells. The outer cork contains reddish-brown pigment, as you can see here in this photo, and it's responsible for the brown color of the licorice root, while the inner cork cells is devoid from the coloring matter. After that, the layer of cortex, as we see in the photo of TS diagram, it contains parenchyma cells packed with starch granules, simple starch granules, and a few prisms of calcium oxalate. After that, the stele region constituted of phloem. The phloem here is characterized by the presence of phloem fiber, phloem parenchyma, and transversed by medullary rays. Phloem fiber here is very important diagnostic feature, and as we will see later in the examination of licorice powder, it will be the key element for identification of licorice powder under microscope. Phloem fiber description is the following: it's thick-walled with a lignified outer part and cellulosic inner part arranged as bundles constituting from 10 to 20 fiber. Each bundle is surrounded by parenchyma cells packed with prisms of calcium oxalate, forming what is known as crystal sheaths. And this is the photo of crystal sheaths under the microscope, which is also a characteristic element for identifying licorice powder under microscope. The phloem parenchyma contain starch grains and crystals of calcium oxalate. Medullary rays fibers alternate tangentially with the medullary rays and xylem vessels. The medullary rays are wider and funnel-shaped in phloem region and contain also starch granules and calcium oxalate crystals. After the phloem, there are intermediate layer between the phloem and the cambium, active meristematic tissue known as vascular cambium, constituted of 2 or 3 rows of thin-walled flattened cells, and then the xylem xylem region, constituted of xylem vessels, fibers, parenchyma, and also transverses such as the phloem with medullary rays. The description of xylem vessels here is very important. Also, they are thick, strongly lignified, and they are large in size, showing different type of secondary thickening or lignification, such as reticulate, scleriform, pitted, thicket wall. This is the photo xylem vessel. As you can see here in this photo, they are very wide, and the most common type of thickening is the bordered bits. Also, xylem fibers present it's same in its structure to the phloem fiber, and also constituting what is known as crystal sheath. Xylem parenchyma containing also starch grains and calcium oxalate crystals. The starch grain and calcium oxalate crystals, as you can see from all the layers, they are present in the parenchyma in the whole transverse section, either in cortex, phloem, xylem, and even in the parenchyma of pith. Active constituents. Actually, licorice containing a very important active constituents which responsible for the great pharmaceutical uses that we will discuss in the next slides. The major active constituent of licorice is a substance known as glycyrrhizine. Glycyrrhizine is a triterpene saponin from the olein type, as you can see here in this structure. It is oleanolic acid derivative, and this is a glycone, olein triterpene, connected to two molecules of glucuronic acid. So this is a glycoside, saponin glycoside, known as glycyrrhizine, or have other names such as glycyrrhizinic or glycyrrhizic acid. It constituted around 6 to 8% of the active constituents present in the licorice root or stolon. Glycyrrhizine is responsible for the sweet taste of licorice. It's 50 times sweeter than sucrose, and when it's isolated, it appears as white crystalline powder, usually consisting of the calcium and potassium salt of glycyrrhizinic acid, because this is acidic salt, have 3 carboxylic acid group, one in the olein moiety of the glycone, and 2 carboxylic acid group in the sugar parts of glucuronic acid. So these acidic groups can interact with the bases inside the plant, especially potassium and calcium bases like KOH or calcium hydroxide, forming potassium and calcium salts of glycyrrhizinic acids. Glycyrrhizinic acid also is known as a typical saponin. You know, saponin is a very important class of natural compounds, but we have a certain problem of most or some of the saponins is that it causes a hemolysis of the red blood cells. So one simple test for identification of saponin is to add the extract or the compound with mils of blood in a test tube and see if it causes hemolysis or not. If it causes hemolysis, so we can say this is a saponin compound or extract containing saponin. But fortunately, glycyrrhizine called as atypical saponin because it can cause froth like most of saponins when shaken with water, but it didn't cause hemolysis of the RBCs or red blood cells, or we can say it has a very weak hemolytic property. So we can use it as intravenous injection, as we will see later in the part of uses. So this is a very good property about glycyrrhizine, make it favorable rather than other saponins. Actually, the bioactive part of glycyrrhizine is not the glycoside, because when we digest or administer the glycyrrhizine orally, it's hydrolyzed by the action of intestinal flora or the acid in the stomach to afford the glycyrrhetanic acid. This is the aglycol moiety and the 2 molecules of glucuronic acid. This is also called inoxidone. This is the aglycone part, which is the bioactive responsible for most of the pharmacological activities we will discuss later in this presentation after the constituents. The most important action of licorice or glycyrrhizine is called corticosteroid-like effect. It's similar to the cortisone in its action, but with no side effects, except it causes hypertension or increase the blood pressure of some patients. So it also contains other active constituents, very important rather than the glycyrrhizine. So as we can see, there is some supplements containing the called DGL. What is meaning? It's licorice extract without its glycyrrhizine. You know, it's similar to the decaf tea or decaf coffee. There is tea in the markets now available, which is free from caffeine. Also, we have some licorice supplements. It's free from glycyrrhizine, so that hypertensive patients can make benefits from using this supplement without the side effect of increasing their blood pressure or hypertensive crisis. So this extract or this supplement called the DGL, which means deglycyrrhizinated licorice, or licorice extract with glycyrrhizine removed. So after that, the main active constituent in this extract will be the flavonoids. Licorice extract containing several types of flavonoids which are very important for their pharmacological activities. It contains flavonones such as liquoritin, glucoside, and its glycol known as liquortigenin. It contains isoliquoritin and isoliquortigenin, and also the isoflavones formamintine and glabrin. These isoflavones also is very important, making the phytoestrogen effect of licorice extract. It's very important. For example, in women with menopause, it acts inside the body like the estrogen, as we will see later in this presentation. Licorice also contain essential oil containing active constituents such as geraniol and geranyl hexanolate, sterols such as beta-sitosterol and dihydrosterols, as well as other constituents such as coumarins, polysaccharides, and bitter principles, which are present mainly in the cork or outer tissues. So in most cases, the licorice used in pharmaceutical preparation is decorticated to get rid of these bitter principles and improve the taste of licorice. Chemical tests. The powder could be of licorice could be identified using 66% sulfuric acid, with the powder give orange red color. Also the frost test, because it's the active constituent saponin. The powder shaken with water forming persistent froth due to the presence of saponin, or if the powder is treated with potassium hydroxide, the yellow color is developed due to the presence of flavonoids. Uses. There are several important and potent uses for licorice that will be discussed in this lecture. The most important use for licorice is its anti-ulcerous effect. It's used in the treatment of gastric and duodenal ulcer. The DGL, which is deglycyrrhizinated licorice, stimulates the normal defense mechanism, increase the rate of mucus secretion rather than reducing the acidity, and so prevent the gastric ulcer in patients taking ulcerogenic drugs such as aspirin and non-steroidal anti-inflammatory drugs. You know, the chemical drugs such as proton pump inhibitors and antihistaminics used in the treatment of gastric ulcer, working by inhibition of producing HCl in the stomach, and after long time treatment with that medication, the patient suffer from another problem which is called dyspepsia or digestion problem. So here its advantage using licorice over that drugs in mild ulcer or not severe ulcer, because it's not affecting the secretion of normal acid from the stomach, but on the other side it increases the rate of mucus secretion and protecting the stomach from its acid or the effect of increased acids, either due to unhealthy diet or due to using drugs such as non-steroidal anti-inflammatory drugs. So here the active constituent making this mechanism is mainly the flavonoids, especially in DGL. Also there is a semi-synthetic compound derived from the inoxabolone or the aglycone of glycyrrhizine, known as carbinoxolone. This product is used for the treatment of peptic esophageal ulcer, and available in the market as carbozine tablets or as a gel, as you can see here in the carbozine gel, for the treatment of oral ulceration and inflammation, and this is very important for a treatment of this problem. Other uses of licorice include anti-inflammatory and anti-allergic activity. We said previously that licorice has a corticosteroid-like effect due to its active constituent glycyrrhizine or its aglycoinazolone. Also, the liquirtine flavonoid has anti-inflammatory and anti-allergic activity, and so they can work effectively because of its anti-inflammatory and anti-allergic activity in the treatment of respiratory tract disorders, either used as demulcent for the sore throat, expectorant in the treatment of cough and bronchial cataract, and antitussive. The glycyrrhizine, as it increases the mucus secretion, it also increases the tracheal mucosal secretion and make emollient effect for the cough. The flavonoids present in licorice, such as liquirtigenin and isoliquirtigenins, has a spasmolytic effect which exhibits the antitussive effect for the licorice, and also the isoflavonoids has antibacterial effect which could be beneficial for the treatment of the respiratory tract infections. Because of all these benefits of licorice for the respiratory tract, some products include the licorice extract for the treatment of cough. For example, we have here in Egypt this product named Evican. It's a mixture of licorice and ivy leaves extract for the treatment of cough, and it's highly prescribed and a very effective product. Also, some brands or medications contain licorice extract in the lozenge, such as this one, for the treatment of sore throat. Additionally, licorice has immunostimulant and antiviral activity due to its active constituent glycyrrhizine, which improve the immune function, activate macrophages, and increase the natural killing activities. So it's used as a phytoaid in the treatment of HIV, hepatitis, and herpes simplex virus infections. Also, this is a very important use for the licorice. It has anti-hepatotoxic and hepatoprotective activity. It makes inhibition of the free radical formation through antioxidant effect. We have a product in market called SNMEC, which is abbreviation for stronger neominophagen C. This is an intravenous injection composed of glycyrrhizine and amino acids such as cysteine and glycine. It's used intravenously to improve liver function in patients with hepatitis B. And here I have to remember you with the information that the glycyrrhizine is a topical saponin. It has a very weak hemolytic activity, so we can use it safely as intravenous injection to improve the hepatitis B patients. Also, because of the sweet taste of glycyrrhizine, licorice can be used as a sweetening or flavoring agent to distinguish the taste of bitter medicines. Or in infant formula, we have, the herbal formula to relieve colic for infants using phenyl anise and dill oils or seed extract. Usually we didn't add sugar in the infant formula for colic because already sugar is the main cause of colic in newborn, but some parents using natural sweetening agents such as licorice to make the taste of this formula is acceptable or palatable for the babies. And also some herbal tea use the licorice as a sweetening or flavoring agents. Topically, licorice has several effects. As we said previously, it has a corticosteroid-like effect, so used as anti-inflammatory drug for the treatment of eczema, psoriasis, and contact dermatitis. Glycyrrhetanic acid, the aglycone or inazolone, aids the hydrocortisone cream in the treatment of topical eczema and contact dermatitis, and it act in the same way, could be replaced could replace the hydrocortisone treatment and could used with it to support its action in the treatment of these topical inflammatory diseases. Additionally, licorice has antiviral effects, so could be used in the treatment of viral lesions such as herpes simplex zoster. It has anti-ulcerogenic effect as previously prescribed, especially the DGL and the carboxylone. So could be used in the treatment of mouth ulcers. And finally, it's a trendy nowadays for the treatment of hyperpigmentation or as a skin whitening agent in several cosmetic products, including creams, face serums, face gels, and also facial masks. These are two examples of facial creams named Artemia and gel named Jacodin gel available in the pharmaceutical Egyptian market, containing mainly the licorice extract for the treatment of hyperpigmentation. So if I want to use licorice to treat any of the prescribed indication we discussed in last slides, what is the dose I can use licorice for these treatments? If I will use the licorice root, I could use from 750 milligram until 15 gram daily and safely. Licorice extract you could use from 100 to around 100 milligram to around 1 gram daily for up to 24 weeks. If you are going to use glycyrrhizine as vial or as in NMCY injection, for example, you can use up to 100 milligram per day. And if you are going to use DGL, deglycyrrhizinated licorice, you can take the dose from 150 to 300 milligram daily. These are the safe doses. But what will happen if you use higher doses or use the licorice for a very long time? You will suffer, maybe you will suffer from some of the adverse or side effects of using licorice. You know, we have a false concept that using herbs or medicinal plants is completely safe. No, it contains a chemical constituent inside it, so it has benefits as well as adverse and side effects. So in the next slide we will see what will happen if you use much more licorice or high dose of licorice. The basic of the side effect is the same as the basic of the uses, which is corticosteroid-like activity. Most of the uses depend on that concept, the corticosteroid-like activity, and also it has the main side effect due to this activity. As you know, cortisone makes sodium water retention inside the body and result in high increasing the weight of the patient receiving corticosteroid treatment, as well as hypertension due to the retention of sodium and water inside their bodies. And also this patient receiving corticosteroid have hypokalemia due to depletion of high potassium on the expense of retained sodium inside their body. The same happens when consuming a high dose of licorice due to corticosteroid-like effect or aldosterone-like effect. What will happen? Imbalance in the electrolytes, sodium and water retention, and potassium depletion resulted in hypertension and suppression of renin-aldosterone system. When will this happen? This adverse effect is common at a dose of licorice extract more than 400 mg per day and rarely reported with a dose of licorice extract more than 100 mg per day. The second adverse effect, consuming a high amount of licorice, 5 grams or more daily, can lead to heart attack in people with heart disease, kidney disease, or high blood pressure who are more sensitive to this adverse effect. Contraindications. Who can't administer licorice for treatment of their ailment or use it cautiously under medical supervision? People who have heart conditions, because as we previously described that licorice could lead to increase the rate of heart burn or heartbeat or heart attack. Also, hormone sensitive conditions such as breast cancer, uterine cancer, ovarian cancer, endometriosis or uterine fibroid, because as we previously described, licorice contain isoflavonoids which act as phytoestrogen, resembling the effect of estrogen in the body. So those conditions are very sensitive to the estrogen level, and the high estrogen level or phytoestrogen could worsen these conditions. High blood pressure, also licorice used cautiously or under medical supervision for patients with high blood pressure, because its corticosteroid-like effect may increase their blood pressure, so should be avoided, or alternatively those people could use the DGL. Muscle condition caused by nerve problem named as hypertonia. Licorice can cause lower potassium level in the blood, and disease can make hypertonia worse. Low potassium levels in blood, hypokalemia. Licorice cause hypokalemia because its aldosterone-like effect, so it should be avoided to be administered by patients suffering from hypokalemia. Also, licorice should be used cautiously or should be avoided in patients with kidney disease, because the licorice extract worsen this disease. And what is also about contraindication for licorice, it couldn't be used with large amount or for long time in males, because it affects the fertility of men. Licorice can lower interest in sex and worsen the erectile dysfunction, because it causes lowering to the testosterone level in males. Because licorice affects the blood pressure, it could interfere with the patient going to the surgery, so should be stopped 2 weeks at least before a scheduled surgery. Also, in pregnancy, it's unsafe to take licorice during pregnancy. It might cause miscarriage or early delivery. Eating about 250 grams of licorice per week seems to increase the risk of early delivery. While in breastfeeding, we didn't have reliable information enough for the safety of licorice, so should be also avoided in breastfeeding. Drug interactions. Licorice show mild interaction or major interaction with the following drugs: digoxin or lanoxine, used for heart failure. This drug causes low potassium of level, hypokalemia, and also the licorice cause hypokalemia, so administering the both drugs together could result in severe hypokalemia. Also, low potassium of level caused by licorice can increase the side effect of digoxin. The second interaction with estrogen. Taking licorice along with estrogen might decrease the effect of estrogen. This happens when administered orally, but when administered topically, the licorice support or increase the effect of estrogen on the skin. Diuretics also, diuretics as well as licorice, both causing hypokalemia, so administering both drugs together could result to severe hypokalemia. Antihypertensive drug. Taking licorice might reduce the effect of these drugs because it works in the contrast way. It increases the blood pressure. The corticosteroid effect. Licorice can decrease the metabolism of corticosteroid, increasing its effect and side effect, as we said topically. Warfarin is used to slow blood clotting. Licorice may decrease the effect of warfarin and increase the risk of clotting. Cisplatin, this is anti-cancer drug. Licorice might increase the metabolism and decrease the effect of cisplatin. Paclitaxel also is another example of anti-cancer drug. Licorice might increase the metabolism and decrease the effect of paclitaxel. And finally, midazolam. used for anesthesia and sedation, procedural sedation. Licorice might increase the metabolism of midazolam and might decrease the effect of midazolam. Examples of licorice products in Egyptian pharmaceutical and herbal market. We have several examples of products and there are more and more available. For example, this product contains licorice root, and this product is a liquid extract from licorice. Those are dry extract found in capsule, either the licorice root extract or the DGL. Also, we have here a liquid extract for the skin, used as a skin serum. And also we have intravenous injection for the treatment of hepatitis patient, as well as topical creams such as Arsenia, Jacodin gel, Carbozan, and also the lozenge for treatment of sore throat. I hope this lecture was beneficial for you, and now you know more about the phytochemistry, the pharmacological activities and uses, and for licorice, as well as those side effect contraindication, and how you could make benefit of licorice plant and avoid its side effects. Thank you for hearing this lecture, and if you have any question, please write it down below this video. Thank you.